Hello, my name is Gloria and I'm one of the midwife sonographers in the early pregnancy unit. Normally, the first scan is at your booking visit and it's usually between 12 and 14 weeks. But if you have experienced any bleeding or a history of ectopic or a history of recurrent miscarriages, they might refer you to the early pregnancy unit when we will do a scan in there. The aims of an early pregnancy scan is to determine that the pregnancy is in the correct place, the viability of the pregnancy, how many babies are there, and to determine the gestational age to see how many weeks you are in the pregnancy. We can see the heart beating of your baby from around 6 weeks, but we will be able to listen the heartbeat after 12 weeks in the ultrasound scan. The routine maternity care in Ireland is free of cost, so you don't need to pay anything.
Hi, my name is Debra. I'm one of the advanced midwife practitioners here at our emergency and assessment unit at the Rotunda Hospital. Many of you will know my face from coming in and out, hopefully for good reasons. I work in the unit for the last few years, and I see a lot of early pregnancy patients coming through our department. Most of the time I give some really good news. Sometimes I give some bad news, which can be very, very difficult. So I suppose we see a range of patients from 0 to 42 weeks pregnant. Sometimes we see patients after when they have their babies, and sometimes we see babies for the first 2 weeks of their life. Part of my role is to assess and care for women in early pregnancy when they present to our emergency department. Women present to the emergency room in early pregnancy with complications such as pain, bleeding, and nausea and vomiting in pregnancy. So on presenting to the emergency room with symptoms such as bleeding or pain, you will be triaged by one of the midwives. Your history will be taken and a set of vital signs will be taken also. The amount of bleeding will be assessed, and the level of pain that you were in at that time will also be assessed. Once your triage assessment is performed, you will be seen by usually myself, an advanced midwife practitioner, or one of the senior house officers or registrars at the emergency department. If you have symptoms such as bleeding or pain, a scan will be performed to assess the pregnancy. If you are over 6 weeks, after 6 weeks, usually a trans-abdominal scan, which is a tummy scan, will be performed. If you are less than 6 weeks, we may offer an internal scan if required. If you present to the emergency room with pregnancy of nausea and vomiting or hyperemesis, an assessment is made and you may need to have a cannula or a drip put in your arm, and we may give you some fluids and some anti-sickness medication, sometimes in through a drip or an injection, depending on how much you're vomiting. You're kept with us for a few hours, and an assessment is done by either one of the SHOs or the advanced midwife practitioner, and a scan is also performed when you come in with nausea and vomiting, just to ensure that we have a viable pregnancy there and make sure that you just have one baby or 2 babies in some occasions with hyperemesis. In some pregnancies, we may recommend, a doctor or midwife may recommend that you need a scan before 12 weeks. But in normal pregnancies with no complications, a scan at 12 weeks is what we recommend. It's the best time to get the appropriate crown rump length, which is the gestational age of your pregnancy. I suppose most people will tell their families around the time of the booking visit, but I suppose it's very individualised. There's no wrong or right time to tell your family, whenever you feel is the best time. Some people may need support in early pregnancy to help them get through. If they're having a tough time in early pregnancy, it might be helpful to tell your family, but really that's a very individualised question, that is one that you kind of have to answer for yourself. So the non-invasive prenatal testing is an additional opt-in test that can be performed here at Rotunda. It's not done routinely, and if you feel like you would like this done, you can look up the website or call to the fetal assessment unit for an appointment, and it's usually done between 9 and 12 weeks. Unfortunately, a positive outcome is never guaranteed, but it's very reassuring to see a fetal heart on scan at 8 weeks or any time in early pregnancy. So around 12 to 14 weeks is the optimal time to date your pregnancy. So I suppose if your cycle is irregular, we will do what we call a crown rump length of your pregnancy, which is the top of the head to the bum, and we will assess your gestation. Your dates may need to be changed, but we don't need to do an earlier scan than this. This is the optimal time to have your first scan. So I suppose there is no need, if you don't have any pain or bleeding, there's no need for any additional scans in early pregnancy. But I suppose your booking visit at 12 weeks or 14 weeks, your care pathway will be decided then.